cause of acute pancreatitis in children. बच्चों में गॉलस्टोन होते नहीं और बच्चे पीते नहीं. बच्चे खेलते कूदते रहते हैं. So the most common cause is trauma. Now what will happen in acute pancreatitis? There is a blockage of the pancreatic duct at this point, right? What will happen to the pancreatic juice? Pancreatic juice is coming here. It is facing a resistance. So the back pressure, pancreatic duct will be dilated. Diameter of pancreatic duct 2 to 3 millimeters. That is very small. So what will happen? Ultimately, stasis, congestion. This will lead to pain. Plus, there is a possibility that the duct may disrupt at some point. If the duct disrupts at this point, what will happen to the pancreatic juice? Pancreatic juice will come out. Pancreas lie in which part of the abdomen? Epigastrium. Preperitoneal, intraperitoneal, retroperitoneal. Preperitoneal, intraperitoneal, retroperitoneal. There. It is retroperitoneal. It is retroperitoneal. Pancreas is here. Kidneys. Second and third part of duodenum. Retroperitoneal. So these pancreatic enzymes, they leak around the pancreas. What was the function of pancreatic enzymes? Digestion. So these pancreatic enzymes will start digestion. Digestion of fat and digestion of pancreas. Sometimes autopancreatectomy can occur in acute pancreatitis. But generally what happens, these enzymes keep on digesting the pancreatic tissue, causes necrosis of the pancreas. That is called as necrotizing pancreatitis. Whenever this reaction takes place in the retroperitoneum, lot of pancreatic juice in the retroperitoneum, again the peritoneum will try to neutralize this pancreatic juice. In order to neutralize this, it will secrete lots and lots of fluid. Acute pancreatitis is nothing but a condition of shock. How? Because lot of fluid is sequestrated into the retroperitoneum. That is the basic pathology in acute pancreatitis. Patient presents in a shock-like condition with marked abdominal pain. Because of this shock-like condition, treatment for acute pancreatitis is actually treatment of shock and nothing else. 85% of patients are treated successfully with this conservative treatment of shock. Gradually, if the stones that travel into the intestine, then the rasta is clear. The pancreatic juice will start going into the intestine. Whatever pancreatic juice was going outside, that will follow this rasta and go into the intestine. So the condition resolves. Right. Now the different pathological stages in acute pancreatitis. There are 3 stages in acute pancreatitis. Acute interstitial pancreatitis, acute edematous pancreatitis, and acute necrotizing pancreatitis. This is sometimes also referred to as acute hemorrhagic pancreatitis. As the name suggests, Interstitial means there is simply inflammation of the pancreatic tissue. Edematous means edema in or around the pancreas. And necrotizing means necrosis of the pancreas. Necrosis of pancreatic tissue, which may or may not be associated with bleeding. Acute pancreatitis is a condition of shock with marked.
Sir, in case of necrosis in acute pancreatitis, even if the necrosis is present, the patient is treated for hypovolemic shock?
Yes.
Or no surgical intervention?
No. Reason is,
What about necrosis?
shock is a much more important condition than necrosis itself. No? Because you have to treat the shock first. You have to first stabilize the patient.
No, after that,
After that, yes, definitely. We need to do something for this necrosis. What is necrosis?
gangrene. Gangrenous form.
What is the difference between necrosis and gangrene?
Macroscopic and microscopic.
Yeah. Necrosis is microscopic cell. Gangrene is macroscopic cell with superadded putrefaction. Right? Now, what we should do for necrosis? There is already cell death. There is already a auto defense mechanism inside the body which causes removal of this dead, dirty tissue. Right? If that is small. If the necrosis is sterile, if the necrosis is non-infected, then we follow a conservative treatment. But if the necrosis is infective, then we have to remove this infected necrotic tissue. That is called as necrosectomy or pancreatic debridement. That is a different story. Condition of shock with marked abdominal pain. Site of abdominal pain, epigastrium.